As COVID-19 cases continue to rise across the country, Tim Colbreth, the executive director of Adult and Teen Challenge of Arkansas, recounts dealing with an outbreak on campus earlier in the spring. He says about 50% of the people on campus tested positive.
We probably had a few more positive than negative, but it was like 27 to 24.
That's including both students and staff.
We did have a few staff that were symptomatic. Most of it was mild. We did have one that really struggled, and it took him about 2 months to fully recover.
Program Director Lynn Abels was one of the staff members infected. He found out when he took a student to get tested and decided to take a test himself. Abels says he just had a cough that lasted longer than usual.
It was allergy season too in March and April, and I do have allergies, and I just thought it was another symptom, you know.
Colbreth himself had a relatively mild case, dealing with fatigue, though he says some of that could have been the stress.
I felt responsible for 50 people, and that was pretty stressful. And I probably took on more than what I should have, but I take it very seriously, those that are in my care, whether they're a student or whether they're a staff.
However, he says he's still feeling the effects of his infection from back in April.
I'm a cyclist and I enjoy cycling, and I can't cycle like I used to. I can't get my heart rate up like I used to, and my breathing is very heavy.
According to the CDC, while most recover, even those with mild cases can still have persistent symptoms. The campus remained quarantined for about 3 weeks, and they weren't letting new students in for about a month and a half afterwards. They implemented new safety measures, which Abels says they're still using.
Positive people, once they recovered and came back on duty, they were allowed to work with positive or negative, as long as we wore shields, face masks. We had aprons, thick aprons, kind of like they use in plastic aprons they use in surgery and things.
Colbreth says they also essentially ran 2 programs.
We ran a program for those that were negative. They had a little more freedom to move around on campus versus those that tested positive. They were much more isolated. Staff who were positive worked with the positive students. The staff who were negative worked with the negative students.
Abel says new students coming in are quarantined and separated for 2 weeks.
We know it's a rough start, and it's rough for them to come and be separated from families, but it's just necessary to keep the rest of the student body healthy and COVID-free.
As numbers continue to rise, Colbreth has this advice as someone who handled an outbreak.
You've got to do social distancing. You got to do mask. I'm more than 6 feet away from the camera. Otherwise, I would have a mask on.
He says they were already being cautious and had pulled back on travel at the time of the outbreak, but people weren't yet wearing masks. He thinks that would have made the difference. Colbreth says he doesn't live in fear, but he respects the virus, and the rising numbers are causing him to worry.
There are stores that I will go up to and I'll look at the parking lot and I won't go in. Even though in theory I should have the antibodies, but I don't trust it.
And there's something he wants people to remember.
This is about health. It's not about viewpoints or politics. It's about being safe and in our health. And you don't know how a person will react to the virus. It can be mild. They could actually probably have it and get over it and not realize they ever had it. To me, that's one of the scariest things, because then there's no telling who you've been able to spread it around with. But it is something to be respected and realize that, hey, I could have a mild symptom or no symptoms, and the next person can really struggle.
We'll show you where to find our previous reporting on the outbreak at hotsr.com.